Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
Good evening, everyone. I'm so delighted to be in the space today for this really important and valuable conversation, especially on this very important day in light of everything that is going on in our world. It is a very timely and important conversation. So I would like to just take a moment to welcome the panelists. If you could say a little bit about yourself for the audience, we'd love to have that. And I am your moderator, Tracy Jones. Dr. Curley.
Good evening, and it's a pleasure to be here. My name is Dr. Condessa Curley. I am Medical Director for Clinic Services for the Los Angeles County Department of Public Health. I am also the lead physician for the COVID-19 worksite outbreaks throughout the county and a member of the board of AIDS Healthcare Foundation. I'd also like to add that I'm also someone that was COVID positive. I experienced this while working, and that was back in April of 2020. And I have subsequently, after much thought, inspection, and understanding, have been fully vaccinated for the COVID-19 vaccine. So it's a pleasure to be here.
Thank you for sharing that. Thank you so much. Alejandra, please.
Thank you, Tracy. Hi, everyone. My name is Alejandra Aguilara Velino, and I am the lead health educator and HIV navigator from the East Los Angeles Women's Center, one of the local crisis centers for survivors of sexual assault and domestic violence in Los Angeles County. It's a pleasure to be here. Thank you for having me.
Thank you. Alexis.
Hello, everybody. My name is Alexis Sims. I'm currently a fourth-year PhD student in public health at the University of Texas School of Public Health, the UT Health Science Center. I am currently working on my dissertation. My research is in HIV prevention among Black women specifically, and a lot of my research focuses on PrEP and promoting PrEP for HIV prevention. I'm also excited to be here, fully vaccinated, and excited to talk with you ladies.
Absolutely. And Alejandra, I don't know if you would like to share whether or not you're still in the decision-making process or if you have been vaccinated.
Fully vaccinated. I am very thankful to have been able to get the vaccine. My family as well, my husband, my daughter, and my family members have finally said yes after much push from me. They were able to understand how important it was for them to get vaccinated, not only to protect their health, but also to protect the health of others. So I'm very, very excited. I'm really looking forward to in the future to be able to see everybody, again. But yes, fully vaccinated and very, very happy and eager to share the importance of vaccination with everyone in my community.
Absolutely. And I'd like to join the crowd and say that I too am fully vaccinated. And so I'm hoping as we start that we could just discuss what you ladies have found in the way of the nexus between COVID vaccination and HIV. We are having a pandemic within a pandemic, and how that relates to your work as a provider of services or as a student, and how you think that we can continue to move that conversation forward, because knowing that that's, it's hard enough to talk about HIV, but now we have to talk about it in the context of a pandemic. So I'd love to hear your thoughts around that.
Please. Well, thank you for that question. Did someone want to start?
No.
Okay. All right then. So I think, if we look at the nexus between HIV and COVID-19, it's very interesting. I won't talk about the pathophysiology or the mechanisms of action of the viruses, but what I will talk about is more the the social determinants and how that relates. So if we look at HIV, those of us that were around early in the 1980s, when it first came about, there was a lot of stigma and discrimination. There was a lot of unknown. When I started taking care of HIV patients, we actually put them in the cancer ward. And if you realize too, that cancer at once upon a time, there was also stigma and discrimination as well. In fact, there were some folks that believed if you touch somebody that have cancer, you would get cancer, and the same thing with HIV. So the stigma and the discrimination, if you look at the fact that insofar as social determinants of health, who is most impacted? Well, it's the people that, you know, typically have been most impacted. Those that are in communities that are low income, those that are people of color and Black and brown. And if you look at the disparities of health, that also falls in line with it. So the stigma and the discrimination with and fear, stress and anxiety that was associated with HIV, we currently have that very common in our COVID-19 pandemic. If you look at even more so with HIV, you know, we have come a long ways. I mean, at this point, we have treatment. We still have fear, stigma, and discrimination, and we still have places where, you know, Black and brown are discriminated against as well. But with COVID-19, we have another complication. What we have here is not only the fear and the stigma and discrimination, anxiety and stress, but we also now have a vaccine. And we know very little about COVID-19 as when we started with HIV. And the thing about us with HIV, we've been in this for almost 40 years, so we know a lot. With COVID-19, it's just been a year, a little bit over a year. And the thing about COVID-19, the knowledge is evolving. So what I tell you today may be a little bit different tomorrow, whereas with HIV, it's pretty steady. And so with COVID-19, we have a vaccine. With HIV, we don't have a vaccine. With COVID-19, we have vaccine hesitancy. We have the reasons for vaccine hesitancy, the mistrust, the distrust with the government, all of the things that have happened to us in the past. And we have social media that is more abundant and abound, where most people get their education from, as opposed to with HIV, where we're kind of in silence. We didn't have social media. So for me, you know, those are the distinctions between HIV and the commonalities as well.
Thank you, thank you. Ladies, please.
Yeah, I'll go ahead and jump in and say that as a student, kind of in the research space, doing research, we've been noticing that we've had to kind of shift protocols. You know, there is this, I work in the emergency department settings, and we work in the emergency department to enroll women and provide access to HIV prevention testing and linkage to a clinic for PrEP. What we're noticing is that, you know, our funders are having us really look into our participants and their thoughts and their awareness and knowledge on COVID-19, because it is intersectional. It affects everything and everyone's kind of involvement with healthcare, how comfortable they feel in general when you see a patient. So we've just been having to make sure that we are not only educating about HIV, but we're in making sure our participants in our studies are knowledgeable about about COVID-19 and are aware about the vaccine. We've had many of them ask us questions. So it's just a lot, like you said, there is a pandemic within a pandemic. And so it's just kind of navigating this new normal. And there's so many similarities with the epidemic and how things came out back then when HIV first came on the scene. And we can definitely see those similarities with now, especially like Dr. Curley said, with the discrimination and stigma that is still there to this day, for sure.
Thank you. Alejandra, could you speak to, and feel free to speak to that issue, I'm sorry, didn't mean to cut you off, but I'd love to hear, one of the things that has been very troubling is the amount of domestic violence that we see that has been on the rise as a result of people needing to stay at home, resources being limited. Can you all speak to that issue in particular, and how we can best help folks to navigate around the pandemic within the pandemic, which is also the scourge of domestic violence and youth violence? Please.
Definitely. Thank you. Thank you so much for asking that question. It was something that, as a provider in a crisis center that mainly, supports survivors of domestic violence, not just domestic violence, but sexual assault, victims of rape. It was one thing that as soon as the pandemic began, we knew that these incidences were going to be heightened. These crimes were going to be increasing, and sure enough, it happened. Many of the challenges that we see with women who are trying to access testing for HIV, who are trying to access care, who are looking for information. We found the exact same things happening during this pandemic, during COVID. Partners who are controlling the information, partners who are dictating whether women are going to go to a clinic, whether women are going to be vaccinated or not, those controlling partners, those abusive partners. And we also found that the stressors of, of the pandemic definitely increased the abuse in many families. So we definitely saw this increase. It is estimated that 1 in 4 women will experience domestic violence in their lifetime. The connection that it has with HIV, there's also 1 in 4 HIV positive people in the United States that are women. When it comes to sexual assault, it is estimated that every 73 seconds, a person in the United States is sexually assaulted. Every 9 minutes, that person is a child. And the connection that it has with HIV is that, sexual assault, survivors of sexual assault, especially survivors of childhood sexual abuse, have an increased risk in their lifetime for HIV. And so one of the things that we began to hear also is increase in sexual violence as well. So many connections, direct connections that COVID and HIV have. Thank you for asking that question.
Thank you.
That's kind of interesting. And, you said the 1 in 4, where I've heard statistics now with COVID-19, the number of hotline calls has increased to over 50%. And kind of going back and trying to understand why that happens, with all of the lockdown restrictions that are in place, with the layoffs, the furloughs, with, most women being caregivers, and then the types of jobs that they have, they most of the time bear the brunt of being the income earners. And once that ability is taken away from you, that also increases the stressors. If you look at COVID-19, we look at those numbers, more women than men are getting the vaccine. So there is really something about what women do, as you have said, that really not only targets them for domestic violence, especially in this situation, but also increases their inability to reach out. We look at people being afraid to go out to see their doctors because of the fear of transmission, being able to reach out. I mean, this substantial amount of isolation greatly enhances this. And I can see, with the same thing with HIV, that's a similarity. And thank you for bringing it up. That is huge. Even though we're talking about women, but we must not forget our male counterparts, where I've read that 1 in 10 men are victims of domestic violence as well.
Mm-hmm. Definitely. And 1 in 6, 1 in 6 will be also sexually assaulted. And so definitely, all across the board, it is something that impacts people. One of the things that I also see is many people have experienced and endured trauma throughout their life. And for some, it's complex trauma, multiple traumas. At the height of the pandemic, many people had nowhere to go, right? They had nowhere to go, and just being at home, sitting in with their pain, increase the effects of that trauma. And so we saw, many people reaching out for help, but at the same time, others that were, coping with their pain in isolation. They were at home, safer at home, but in a great deal of pain, and this collective trauma that we are all experiencing.
Right.
Alejandra, you're reading my notes. I wanted to speak to that issue, and Alexis, I'm hoping that you can help us out in this regard. One of the things that always comes to mind for me on a pretty regular basis is guilt. Like, women carry around, in addition to the trauma, guilt that I can't get to the nursing home if my mom's in the nursing home, guilt that I can't get to the game, guilt that I got to leave my kid at home because I got to go to work. Like that collective guilt that we're facing, and how that's playing into how we're going to convince our loved ones to get the shot. Like, just what you can speak to that.
Yeah, you're absolutely right. There is a lot of guilt, and this is across age groups. I have a lot of friends. I'm in the student community, but we all are trying to make sure that as public health students, we're able to go back in our communities with people kind of are in our age range, people in our families, and tell them, this is what we know as professionals, and this is what we are seeing about with the vaccine. We try to share as many statistics and facts as you can. I always, hear people have different opinions, kind of that guilt, like, should I get this? But I don't trust the system. I don't trust, I don't have a healthcare provider. How do I is this going to be a cost for me? Will I have any side effects? All of that comes into place on top of those everyday responsibilities that they're trying to juggle. And, mental health, it all kind of, intersects how people are able to manage and make an informed decision the best that they can to get the vaccine or not, to protect their health. And so what we can do as professionals and in my space in the emergency room is to really make sure access and knowledge is there. That's what I see as the go-to in the moment. What can I do in the moment? Just share as many resources or tips or interviews. Social media has been, it can be a curse and a help in this aspect. So there's things we can all do to play a part, but for sure it is a big issue.
Dr. Curley, one of the things I noticed and was floored by is first of all the amount of heart disease in the female community, and then overlay on that the African American female community, and now overlay on that this COVID infection. What should the community be hyper focused on around making sure that we don't have that be exacerbated in the female community?
Well, there have been studies that have shown that the emergency room and hospital visits were greatly decreased at the height of the pandemic. So people were staying away. People were not going to see their doctors. People were afraid to go to the pharmacies to get their medications refilled, and were afraid to really go and do the preventive care and maintenance that they need to do. Quite naturally, if you have heart disease, seeing your dentist annually is really key, because gum disease really impacts and can affect, your cardiovascular system. So all of this was put aside because of the fear of catching COVID-19. So now that we have turned the tables a little, Right now in LA County, we're at a 1% infectivity, which is really great. We have at least 27% of people in different communities vaccinated. We have up to 50% of people that are have had their first vaccine. So now that we are beginning to see and understand what we need to protect ourselves, people are slowly going back. So the first thing is that, you know, it's always important to keep contact with your doctors. And in this day and age, you know, we have medicine, telehealth. A lot of the doctors in the hospital systems have really become very innovative and creative as to how you can see your doctor. But it's really, really important. If you have chest pain, nausea, vomiting, shortness of breath, pain radiating to your jaw, you have a history of hypertension and it's not being well controlled. If you have a history of elevated cholesterol or diabetes, you need to go in to see your doctor. But the first thing that you should do is call them. Make sure that you're not symptomatic for COVID-19. Make sure that they can have, make sure that they can tell you when you can come in. And they may say, you know, your symptoms sound like you need to go to the emergency room. So go to the emergency room by all means. I mean, I hate to tell you this, but a lot of, we've had a lot of people who have died at home alone, and they've had all these comorbid conditions, but they were just afraid to go. So we as women and as healthcare providers and givers, we tend to protect others. We tend to put ourselves last. But you know what we really have to do is if you're the head of your household, if you're the person that is really, you know, the nurturer and the one that takes care of everything, it's not selfish for you to put yourself first when it comes to your health. So for cardiovascular disease, we know that's a major killer for African Americans. We know that diabetes is along with that, the sequelae of end-stage renal disease, all of that. You know, if you had it and you haven't seen your doctor, you really gotta talk to your doctor. Get in there, make your appointments, make sure that you speak closely with your pharmacist, make sure that your medicines can be updated, make sure you got a 90-day supply at home all the time. You know that some insurance companies will only give you 30, but have your doctor talk to them and give you 90 days because, you know, that's just being prepared.
Absolutely. Alejandra, I know we had this fabulous discussion about trauma, but one of the things that strikes me about this particular pandemic is how many folks on the front line, especially women, especially Black and brown women, have had to go to work. It didn't really matter. We didn't have the luxury because we are frontline workers. I worked all the way through, you know, of saying, I'm going to work from home, you know, and I'm going to be providing the same level of work support. But it's not the same. You got to get up and the fear that I know I felt that has been paralyzing at points in time. What can we tell the folks around making sure that they're taking care of themselves mentally and emotionally, knowing that they don't have that luxury of, oh, I'm just going to work from home for the next 6 months.
Definitely. Yeah, you mentioned something extremely important. First and foremost, be very gentle with ourselves, not push ourselves beyond what we can provide, right? There are so many needs in our community, so many needs that at times it feels like we need to stretch ourselves very thin in order to be able to respond and provide. Be very gentle with ourselves and take this opportunity, take some time also to heal. You know, it is no secret, you know, many providers are also survivors of, you know, multiple traumas. And so take time to heal. You know, it has been known that early trauma has a direct impact in the inflammatory system, right? It directly impacts our health. So take time to heal, practice self-care, true self-care, you know, brushing our teeth, drinking water, taking breaks, getting enough sleep. This is how we can protect ourselves, or almost like insurance, so that once we are over the pandemic, we can be here fully healthy. You know, I caught myself, you know, falling back into habits that I knew eventually were going to catch up with me. And so I had to stop and remind myself, be very kind to yourself, Alejandra, and go on. Take a pause and then go on, right? So that you can be here in the long time. It can be tough. It can be tough putting on a front when we're providing a service, but we have to remind ourselves, we are all experiencing this. You know, we are all experiencing but definitely be very with ourselves and connect with others, connect with our provider. It has definitely been some positive things, you know, in the midst of everything, to be able to connect. I had never had such long conversations with my medical provider. Never. But now that this happened, I was able to find, you know, other things that I needed to address as far as my health, because I had this opportunity to chat one-on-one, you know, on a video call with that provider. Mm-hmm.
Alexis, and then Dr. Curley, to overlapping question. I don't know about you ladies on the line, but I know for me, I have really struggled to keep my connections with friends. You know, and what that connection looks like. You know, I've been much better with family, you know, because family's like, we're going to do a Zoom every week. But I have really struggled around connections with my girlfriend, you know, because a lot of that interaction happens to be face-to-face usually. And I wanna talk, Alexis, that, and then Dr. Curley, to speak to, I know I've heard from friends that they're really experiencing significant weight gain. What can we do to ensure, like Alejandra said, when we come out of this, that folks are whole and healthy? So, like, can you give us some insights around what we can do to continue to be healthy and combat the COVID fat? So we'll start with the girlfriends and move on to the weight.
Yeah, so that is a really common thing. I've definitely can attest that I've, you know, had fewer interactions with friends and classmates. You know, I'm in students, I used to, you know, join study groups, but all of that has been kind of put on hold. We have just been looking at ways to engage virtually. And, you know, I know not everyone has access to computer or may have their own laptop, but Facebook, social media, kind of joining lives and kind of being able to see people without being there is been really helpful for a lot of people, and to maintain connections. Because that sense of community is so important. We don't want people to feel alone and like they're going through this. We're all going through this together. And so I always like emphasize, just have, you know, someone you can flesh things out with, talk it out, kind of vent to, because, you know, there has been an increase in binge drinking because of the stressors been related to people managing the pandemic, work-wise, having social life. So I know all of those things come into play, and it's just important to make sure that you at least have someone you're talking to and to kind of not stay to yourself. And then you mentioned the second part of your question, which was about, what can you remind me again?
Oh, it's just about the weight gain, which is,
yeah.
You know, maybe it's just me.
None
of my clothes fit anymore.
You know, you had to be so intentional about it. Going outside for walks. I know for people who work from home, you can stay in the house all day and never leave, and realizing I haven't been fit. I've been snacking. It's so easy to just go to the refrigerator while working. So it's just always making sure, if you're gonna do snacking, have some healthy stuff available for you, because like Alejandra shared, it can catch up to you after enough time passes and you create different types of habits. It is a big thing. So just going outside, that light therapy is real. Having the sun hit your skin, being able to walk, and it'll relieve stress and keep you healthy.
Yeah, I totally agree. There was some studies, so we were just looking at this, and what some of the studies found that is that 68% of people have snacked more during COVID-19, and about 74%, they're cooking more. And then 61%, that Grubhub bill is really high. And then 54%, they have exercised less. And similarly, 54% of people say that they've gained weight. And you talked about that. So, I think it's multifactorial, the sun issue. When we are isolated, we don't have that same human contact. We have to air hug people. We have to air kiss people. All that's missing. And so how do we replace that? And sometimes we replace that, we self-medicate with food we eat. And there's a little bit of depression going on there. So I really liked your observation and your prescription for sun therapy. And what that means is you got to get out. You got to just get some sun. I mean, the CDC says that we should do 150 minutes a week of exercise. And the exercise is just walking. I know what's kind of helped me is that when I'm on these calls, and believe you me, my calls start at 7 and they end really late. I started just taking my phone and walking around my outside, everywhere I could get air connectivity. I was in my house all over. And, by the end of the day, I was up to 1,200 steps. And so, that was something that was very keen for me to really understand. Also, you hit on, what are we putting in our house when we go? So we want comfort food, and it's the comfort food that gets us. And I was just noticing that, when I was walking around and getting my little food for the week, the food store is kind of set up so that the things in the periphery as you go around, those are your staples. But once you start walking down those middle aisles, you're in trouble, because the middle aisles had the candy, the bread, the pasta, the sweets. So just be cognizant of when you're going into the store, how are you feeling? And then also, you never go to the store hungry, because then that means you're going to really visit those middle aisles versus the periphery. So I would say, just be aware. And then sometimes we really have to do some serious self-talk. Like when I go to the refrigerator and I'm looking, and if I can't get something right away that I want, that means that, oh my goodness, I'm self-medicating. I'm not hungry. So then I have to kind of talk to myself. So those are some of the things that I do. I make sure that at least once a day I'm out getting some sun, and I definitely stop sitting and taking all those Zoom calls, because you are so right. That 54% weight gain is very common, and we're going to have some issues. Now, the other thing that we have to be cognizant of is obesity and being overweight. Those are risk factors for COVID-19. Yes. So, if we are African-American, Latino women, and if we're older, or if we have comorbid conditions, we really have to be mindful of that as well.
Yeah. Absolutely. Absolutely, ladies. Oh my goodness. So let's get to the good part, or not so good part sometimes. One of the things we know is we're human beings. The people we serve are human beings, and sex is cheap. So Alejandra, can we talk about, some ways? One of the things that is important to me as an HIV preventionist for most of my adult life is how to help people do what we know they will do safely. What kind of tips can we give folks around dating in the age of COVID while you're at home? Because we know that's much harder. Lexi, please chime in from the young person's perspective, but also how to have COVID sex, Dr. Curley. How do we do this so that we can give ourselves the most protection? So I am looking forward to this part of the conversation. Please, Alejandra.
It's so very interesting that that you mentioned that. I remember that as an HIV provider, for many years I have been, talking to women, hosting, conversations about safer sex, about prevention. And this pandemic was actually a great opportunity to go more in depth and to engage women in conversations about sexual wisdom. about sexual intelligence, about their sexual and reproductive rights, about getting to know their body. For the first time, to take time to get to know their body. For the first time to find out, what brings them pleasure, right? To challenge the norms that tell you that the person you are with is the one responsible for your pleasure, right? And to practice building that sense of empowerment, especially if people don't have a partner at the moment, right? Get to know your body. Yeah, get to know your body, get to know what you like, and be prepared, to ask for what you need. But more than anything is to reflect on those sexual and reproductive rights that we have, just like we have human rights, we also have sexual and reproductive rights. So a lot of fun conversations have been happening during the pandemic. A lot of fun conversations. I found actually that people are more open to discussing issues like self-pleasure, issues about where to put our mouths and our hands and all that. And people haven't actually been more open to safety when it comes to sex, which has been, this has been a dream for an HIV provider. Like, what? You are calling me to ask me for advice rather than me chase you. So definitely there's a lot of tips, but I would like to hear anything from Alexis, Dr. Curley as well, so we can continue the conversation.
I definitely agree with that. We've, when we go into the emergency room, we've been noticing that people are a lot more open to discussing their, what they're doing at home. If we use condoms, we're going in there to talk about HIV prevention, but we can use COVID as kind of a conversation that would, as an icebreaker. We all are surrounded by COVID. It's in our everyday life. We can't ignore it. So it's an easy way to be like, how are you taking care of yourself during the pandemic? And use that as a transition piece to get into, okay, so what other safety measures are you using? Are you using condoms right now? I know that how is it dating? Kind of the questions around that, your partners, how has it been different? And what we've been finding is that most women are okay with talking about it because it is new for all of us. We're all learning how to manage life and doing things that we were doing, but doing it in the sense of it's a pandemic. Dating during a pandemic, is this person vaccinated? Is this person not vaccinated? Do I want to, still be going out to places with someone? Just making sure that at the end of the day, safety is first, condoms and pushing promotion of PrEP and sharing that information. About ways women can protect themselves and still be safe and still avoid COVID infection.
I think the first thing is that you really got to communicate openly about both safety and the boundaries that you're going to have with your potential partner. I think that's key. And then, really asking about your partner's risk for COVID-19. Asking if they are symptomatic, asking them what their vaccine status is, asking them when their last test was. And that's just very important. And then also, if you're going to, engage, then, you really got to think, well, what were my habits before all of this? And how can I change my habits now? So if my habits were to go out, and this is no shame, and I would have safer sex with more than one partner, I'd probably kind of tone it down to somebody that I've known for a little while, and that we can kind of make sure that we're not going out and, with other partners. So just kind of keep it to a small group. Then, people masturbate, they use sex toys. And then when you're masturbating and using sex toys, just like you wash your hands, because of COVID-19, you got to do the same thing with those as well. And it's just monitoring before making out. That is really key. If I have somebody that's coughing, or they got a runny nose, or they have red eye, or they've got a rash, or, that's not a time for us to be engaged. Then definitely we use our condoms and our dental dams. You know, you can stay close without being close, right? You can interact socially, you know, and you can kind of spice things up. And you know, we all have to wear masks. So why not make that mask something sexy? You know, why not
They've got all kinds of masks now.
put
Yeah.
that mask, you know, all over in different places. I mean, be creative, you know. I'm quite sure the mask can go in the face, the genitalia area. I mean, just make that mask very sexy. You know, it's really, you gotta be creative, right? I mean, after you've done all the monitoring, after you've done the talk, and then consent is really key. You know, just like if COVID was not here, consent is key. And if no always means no, and we have to really be sure that we say that. So those are the things that I would really, you know, remind people of. I would also really be cognizant of sharing pictures of you maybe doing sexual acts and nudity. I've seen so many young women get into trouble that way. And so they may think they're connecting with someone. And anytime I hear somebody say to me, oh, he just asked me to take a picture of me with my clothes off, or with my bra on or off, or I was doing these poses, the first thing that I would say is, that's a no. That's no. Because that will haunt you, as you well know, in years to come. So those are my recommendations.
Oh my God, ladies, those were amazing. Ah, thank you so much for that. So my final question, and I must say, this has been, oh my God, more than I could have imagined in terms of the information and the richness of the conversation. So thank you so much for that. And as we draw to a close, one of the things that I continue to be concerned about is the issue of long hauling. You know, what are we looking at in terms of people that have, you know, long-term illness because of this disease? And I know for women, we just continue to push, you know, so we know that there are, you know, treatments online and, you know, you can get vaccinated, but what would you tell women that actually, you know, contracted COVID and they didn't get they drew the short straw and they are really having a hard time? What would be your recommendation, everybody, as to what we can tell women to do to make sure that this doesn't become an albatross? So we'll start with you, Alejandra, and we'll go to Alexis and we'll finish up with Dr. Please.
One of the things is you definitely deserve to be healthy. You deserve to be healthy, and it's okay. It's okay to reach out for help. It's okay to take a pause, definitely. And along with that, if what is stopping you from achieving your best self, your best health, is pain because of trauma, when and if you're ready, get connected to healing. That I will say that.
Thank you.
Yeah, and kind of similarly, there is no shame in, even if you contracted COVID-19, or, you know, the people around you or in your household, there is no shame. There is no guilt behind, oh, I feel, you know, some type of way because I was infected. Oh gosh, you know, that guilt. No, it could happen to anyone. We just all have to protect ourselves. Keep encouraging people around you, you know, to get tested. And you helping yourself and serving and putting yourself first will inspire others to do the same, even if you think it won't. It's super important to, like you said, keep yourself first, keep yourself healthy, and not be afraid to ask questions and not feel bad if you got sick. You take care of yourself the way you can and move forward, because, you know, still have work to do, still have a family to take care of, and taking care of yourself and addressing what you need to do for your health is always what needs to be at the priority. So,
thank you. Dr. Curley?
You know, I think you hit it on the nose, Tracy, when you said the first thing is always prevention. So you know, when we're talking about we're talking to young people and anyone that's got any vaccine hesitancy, we really need to let them know that we don't even know the extent of the long-term effects. We have long hauler syndrome and more women get it than men. We know that. And, 10 to 30% of people, women that are COVID, some people say will have long haulers. Whether it will be 6 months or out or whether it will resolve. So the first thing is please get vaccinated to prevent this, just like with everything else that we talk about. The second thing is, and this is really common, and this goes back to discrimination and racism. You and I as Black women, if we go to see a doctor and we say, oh, I have some chest pain or some discomfort, I think it's gas, they're going to tell us, go home. You're nervous, you're anxious, you need to get some rest, you need to get some sleep. Then what happens 2 days later? They're bringing you in an ambulance because you had a massive heart attack. Mm-hmm. And this is real. This happens. When we go to the doctor, they don't look like us. There's discrimination that goes on. They're just hysterical. So with long hauler syndrome, some of the symptoms are just vague. They are just vague. They're gnawing. It's frustrating as a physician not to be able to pinpoint it what it is. But what I would say to anyone that feels as though they've had COVID-19 and the symptoms just aren't going away, start making a log. Every single day, make a log of what your symptoms are, the time of day when it happens, if there was anything unusual with that, and then present it to your doctor. And let me tell you this, when you and I as women, we go out and we buy a pair of shoes, if the shoes don't fit, what do? We don't buy them. Mm-hmm. If the doctor doesn't fit, you go on to the next one. And so many women and all of us kind of, we feel intimidated by physicians. Sometimes it's intentional that this intimidation is made because they just don't want to deal with or don't have the time. And sometimes it's like a lack of, well, I don't know. So this is frustrating. And I'm not able to tell someone I don't know. So if, please, you have any symptoms, and this is even after you get the vaccine. If your symptoms last longer than 2 days after you get the vaccine, you call your doctor. But if you have symptoms and they're long-term, start logging them, and you go to your doctor and you tell them. And there are places now that are doing research. You can go online. There are places that have support groups, but don't give up. You need to feel as though you're not going crazy. You're not being hysterical. They're telling me you don't know what you're talking about. Oh, you're just depressed. Go out and walk around the block or something. No. Be very, very focused and on point, and make sure you document. So please do that.
And I wanted to make a note, just adding on to that, you do have the right as a patient to request that your doctor refuse treatment or refuse to screen you for something. When you ask, can I get tested for such and such? If that is refusal, you can kindly say, please make a note in my medical record of this interaction, and you have it documented both ways. And so just so you can kind of hold and be accountable for your own health and wellness.
Mm-hmm. That's true.
Definitely. And I will add to that, know the following is, you are not alone. You are not alone. There are many wonderful organizations in Los Angeles County that are there to support you. There are advocates, there are navigators, there are promotores who are gonna be supporting you. You can text them, you can call them, they can help to coach you so that you feel safe and comfortable advocating for your health.
Oh, you ladies are the bomb.com. Thank you so much. Before we close out this session, please give us your last words, anything you'd like to share to the many women that are going to benefit so much from your time today. We'll start with you, Alexis.
I am a big advocate for prevention. So I always say you can empower yourself and feel empowered to embrace and take on and address your own health and your own health journey. We all have had our backgrounds and we've all had our things that may have happened in the past. Don't let that dissuade you. move forward, you can always find a new doctor or a new provider, as Dr. Curley shared. So prevention is key to address things before they get worse. So good luck and get vaccinated.
Awesome.
Thank you for having me.
Oh, absolutely. Thank you for joining. Alejandra?
I will say the same, taking care of yourself also takes care of others. Prevention, more than anything, prevention. And you're not alone.
Dr. Curley, close us out.
So what I want to say is, I want to just give you the benefits of getting a COVID vaccine. But before I do that, I really want everyone to be cognizant of where they get their information from about the vaccine, about the myths that are out there. It's just absolutely amazing. So your resources should be your doctor, someone you trust. If you're going to the CDC or your public health department, please be sure to get your information about the vaccine, what's going on with J&J right now, why it's on pause, and really flesh out those myths. I think if you're better informed, then you can make a better choice. So the benefits of getting the vaccine is that it'll keep you from getting COVID. Once you're fully vaccinated, you can start to do more, and there's a lot that you can do now. It's the safest way to build protection, and that it's an important way in which we can stop the pandemic. The COVID vaccines that are currently available, which is the Moderna and the Pfizer, they are safe and effective, and none of the COVID vaccines can make you sick with COVID-19. So be well and be safe.
Thank you, ladies. Thank you. Have a great evening, and this ends our session. Thank you.